Well, quite a concerning matter there, and hence the department says to us that they had to act swiftly, you know, because they were worried about the patients. If anything could happen while they're inside there, it is going to be their responsibility. Now that the decision was taken on Friday, and about 19 patients have been removed in this particular hospital, being taken to Mahikeng Hospital, General Delare, which is in Lichtenburg, as well as Itsoseng Community Health Center. But however, the provincial Department of Health is saying that this particular facility was in a process of being closed, and we understand that the MEC has been in engagement with relevant stakeholders, which include the health workers unions, the traditional authorities, councillors and everyone, and that process started last year in March to discuss that this particular hospital should be closed, because we understand it's one of the old buildings that were built during the apartheid era, somewhere around 1968, and they are saying that it was in fact built in a dolomitic land. Hence, they are saying that irrespective of them trying to build or rebuild it, it is going to be very difficult for them to keep it intact. So more often it was cracking the walls, which was posing a very serious, dangerous situation for both the patients and the workers. As that particular decision to relocate this hospital was taken last year while they were in engagement with the relevant stakeholders. So we understand this particular hospital has been getting referrals from the local community, which we understand the department is in the process of turning it into a district hospital. This particular hospital, it has been a district hospital catering for about 5 communities, including Itsoseng, Bessisvlei, Lichtenburg, Colini, among others. Now, and also some of the farm areas along the R503 road, which is linking Lichtenburg and Mahikeng. So the department is saying that about 19 patients have been moved to those, some of the nearby health facilities, including Itsoseng Community Health Center, Mahikeng, and also in General Delare, which is in Lichtenburg. So as it stands, they are still inside there, the officials, some of them removing the files and removing all the equipment to be used and be transferred to other various hospitals.
What would this relocation now mean for the heavy reliance that you speak upon from the community members in terms of convenience and having access to a hospital facility?
Quite interestingly, we understand that this particular hospital was built during the apartheid era, in particular for those who did not have funds to can travel as far as Lichtenburg. Now, that's a relevant question to say, what is the impact in particular to those who have been more reliant on this particular hospital? So the department is saying that they are going to use Itsoseng Community Health Center and turn it into the district hospital to carry the capacity of this particular hospital, which is Itsoseng. And I believe that the Community Health Center is not that far much from this particular hospital. That's going to be a mitigation plan from the Provincial Department of Health in trying to assist those who have been receiving services from this particular hospital.